very good evening. You're watching the India Development Debate. I'm Tamanna Inamdar, and our top story on the show this evening is the coronavirus scare, a disease that has now claimed 106 lives and has over 4,500 confirmed cases across the world. In India, the health minister says that there are no confirmed cases of the virus being contracted yet. There are people under quarantine though. Meanwhile, the government is preparing to evacuate Indian nationals stranded in the Wuhan province of China, the epicenter of the disease. The coronavirus has ripped through global markets as well, with Asian markets taking a tumble. In fact, just yesterday, fears of a growing epidemic wiped out over $800 billion of global stocks. The impact has been seen on everything from crude to gold. But the real question on everyone's mind is, how bad can it get? Hoping to get some answers on that front, I'm joined now exclusively by the spokesperson of the World Health Organization, joining me from Geneva, Tarik Jašarević. Thank you so much for speaking to us. Let me begin by asking you how much we should worry about the coronavirus right now. What is the WHO's reading about this epidemic?
Well, this is the new virus, and as with any new virus, we need to understand it first. We need to understand what is the source of it. We need to understand how easily it is being transmitted. We also need to understand how severe it is. So we are working now with national health authorities, especially in China, but with scientists around the world to try to understand this virus so appropriate measures can be taken. Now, even if we don't know all the details, we know that health systems need to be ready, that they need to raise their level of preparedness to the point they can quickly detect and treat people who are sick. So China has shared a very fast genetic sequence of the virus that helped other countries to put up diagnostics. We have seen exported cases from China to other countries. So majority of known confirmed cases have links to China, and then we are really trying to see how easily it is being transmitted from one person to another.
Okay, so now, as of now, what is your understanding? Is it largely contained to China? And because airports around the world, authorities around the world are tightening the screening process, does that give hope that the spread will not be too fast?
Well, China is taking significant measures based on their analysis, trying to stop the spread of the virus. Every time there is a new virus, we are doing basically two things. One is containment, trying to reduce the risk of onward transmission, and mitigation, meaning providing healthcare to those who are sick. And obviously, it's a difficult balance between providing health benefit for the population and introducing measures that will cause some social disruption. Countries obviously are looking into the situation and introducing measures. What we are really from our side trying to work on is to understand this virus and provide health systems with appropriate advice when it comes to clinical management, diagnostics, infection prevention and control measures, as well as risk communications, because informing the population about what we know, but also about what we don't know and what ordinary citizens should be doing is vital.
In the Indian context, you spoke about health systems to identify, diagnose, and possibly prevent the spread of virus. In your assessment, how well positioned is India? One, from the proximity, of course, to China, the kind of traffic which comes back and forth, and the health systems here.
Well, it is really important, especially for countries that see lots of travelers coming from China, to first be on alert, first to know that this is happening. Secondly, because China has shared genetic sequence of the virus at the early stages, countries can quickly develop diagnostics, and we are working with a number of laboratories around the world to really make those assays that can help detect this new virus available quickly. Then, if there is a case that is being is being detected. We need to know the travel history. We need to see who this person has been in contact with, because we know there is a human to human transmission. And then we need to provide clinical care, because obviously people who fall sick with this coronavirus will have better chances if they receive supportive care, because there is no particular treatment right now, as there is no vaccine. We want really health systems also to speak to the population, because we don't want the panic to come in, and that people go to health centers even though they don't have symptoms with the respiratory illnesses. We don't want health facilities to be overwhelmed. So I think national health authorities have really a task to do to really communicate properly to the population.
Again, if I can ask you for any details from the Indian context, is the WHO in touch with the Indian government? What is your assessment of India's capabilities of containing any possible outbreak and ensuring one doesn't happen?
Well, we are in contact with all countries around the world. Our regional office for Southeast Asia is based in India, and I'm sure that all information is being shared and exchanged between India and WHO. And we know that countries in the region have increased the surveillance, including India, and that health systems have been basically implementing international health regulations for last 15 years. And these international health regulations, when they were adopted, spoke exactly about reinforcing national capacities, because we want to ensure global health security, that every country in the world has a health system with the core capacities that is able to quickly detect and to respond to any infectious disease.
Okay, I know you're running late, but just a couple of questions. Is there a cure yet, and do we know how this has started?
Sorry, can you repeat the question?
Is there a cure yet? Or a vaccine, and do we know how coronavirus really started?
Well, when it comes to the source of coronavirus, it's likely that it comes from animal world, as most of coronaviruses. Now, what the source exactly is in the animal world, it's still being investigated. Hopefully, we will have this information, because that will help us avoid the risk of further contact between the source and the human population. There is no cure, there's no particular treatment for novel coronavirus. There is a symptomatic treatment. So in our clinical guidelines, basically, we recommend doctors to address particular symptoms. We know that coronavirus can lead to pneumonia, but can have different symptoms as well, as dyspnea, a problem with breathing, coughing, and these symptoms could be addressed with the things we have. We also should really remember that Middle Eastern respiratory syndrome, that is also a member of the same family of coronaviruses and has been identified 8 years ago. We still don't have a treatment for that particular virus. We don't have a vaccine for that virus. There are things that are being worked on, and we are now looking if those treatments and vaccines that are being developed for MERS could eventually work for novel coronavirus as well.
How deadly is this particular strain in terms of how quickly it can take lives? Because there is a lot of panic, a lot of fake news, forwards among people, and very little official information. So if you can give us answers to these basic questions, it will really help our viewers. How deadly is it? And, to what extent do we need to fear? What kind of preventive measures we can take?
Well, when it comes to mortality ratio, according to the preliminary information from Chinese authorities, the mortality ratio is about between 2 and 4%. This obviously can change, especially because we are focusing at the beginning on severe cases. So we may see in the future that mortality could go further down. But again, it's still early to say. Some information we have talk that people who are really at risk are people over 40 years old with underlying health conditions. We see more people falling sick in that age range rather than a young people. Regarding the advice for the population, it is for the people who live in Wuhan area and other affected areas, is basically if they fall sick, they should not travel, they should seek immediately medical care if they feel the symptoms like coughing, a problem with breathing, high fever. They should go and look for medical care. For other people around the world, it's really basic cautionary measures when it comes to respiratory illnesses. Basically, hand hygiene, covering mouth when coughing, avoiding contact with the people who are visibly sick with the flu-like symptoms, avoid contact with animals at the markets and things like that.
All right, thank you so much for your time. But before you go, just one last message for our viewers watching this. Some people may be panicking. Any message from the WHO on the coronavirus at a time, when global markets are really reacting so much to it?
Well, I think we should all stay calm. WHO and global health community is working around the clock to try to understand the virus. Health systems around the world are trying best they can right now to prepare for eventual new cases. We may see new cases, but citizens around the world should really follow the advice of their local and national health authorities.
Thank you so much, Mr. Tarik, for speaking with us.